Good afternoon, as well as good evening and good morning, and very warm welcome on behalf of ESA to all of you who are joining us from all around the globe. We are delighted to see such a large number of participants. We have more than 200 participants joining this webinar. Supporting the most vulnerable children and families, concrete examples of responses to the COVID-19 crisis is the title of today's webinar, hosted by ESA with the financial support of the Bernard van Leer Foundation. We hope that the presentations, discussions, and examples today will provide you with useful insights and reflections regarding the most vulnerable children and families, and we hope you will learn more about ways of supporting them, especially during and of course after this very challenging period. My name is Alyosha Rudas, and I am a Program Officer and RAIN Coordinator at ESA, the International Step-by-Step Association. For those of you who do not know us, ESA is a membership association powered by close to 100 organizations working in the early childhood field, primarily in Europe and Central Asia. Our work revolves around quality, equity, and high-quality workforce in early childhood services. Today, I won't facilitate this webinar alone. With the help and support of my program colleague Francesca Colombo, who is a Senior Program Officer at ESA, we'll walk you through this webinar together. But not just that, behind the screen is an entire crew supporting us. So dear Teresa, dear Emily, thanks for your efforts, and I suggest that we move to our first slide.
A warm welcome to everybody. This morning, I have the honor to introduce you our 4 experts who accept the invitation to participate in our webinar. Please let me start with Sara Shokri, who is Program Officer at Associazione 21 Luglio, one of the ESA Members Association in Italy. Sara has joined Associazione 21 Luglio in 2019. Previously, she has worked as grant writer for a social cooperative in the north of Italy and also for other NGOs in Rome. She has also participated in several programs implementing educational and cultural activities for children who live in rural areas and on the margins. Then we have Olena Khloba, who comes from Ukraine, and he is an education expert for the Ukrainian StepbyStep Foundation with a specific focus on the ECEC sector. Olena is involved in sectoral work on education policy development and reform process implementation. She's also worked directly with diverse children, assuring a quality education for all of them. Then let's move to Dr. Jeren Güven-Gures, who is a program coordinator for UNICEF Germany. Before joining the Germany team, Jeren used to work as a program specialist to establish the refugee response in Germany. She gathered an extensive knowledge and experience in the field, visiting more than 100 refugee centers all over Germany. And finally, we have Lieve de Boscher, who is director of the childcare service at the city of Ghent. The city of Ghent is working to build a competent system and focus on social inclusion. Every day, the city of Ghent provides childcare for 1,500 children 0 to 3 and out-of-school services in the municipal schools for 3,500 children aged 3 to 6. Before joining the city of Ghent, Lieve was also director of a family center who works to ensure services to vulnerable families such as migrant or Romani families. A very warm welcome to the 4 of you, and thank you again for participating in this webinar. Dear listener, before moving forward, I would like to invite you to share your thoughts and your ideas and suggestions and your question in the question section in the panel on the right side of your screen. We plan to have some short session of question and answer, so I will pick some of your questions and we will go and address them throughout our webinar. Before moving forward, I would like also to remind you that this webinar is recorded and we will share the recording with all of you who register, so you can also choose to share it further inside your network. Finally, I would like to invite you to stay connected. You can check out more information about ESA on our website, where you can also search for meaningful tools and resources in our Knowledge app. You can follow us on the social media and subscribe to our YouTube channel to see also our previous webinar. And now I have the pleasure to give back the floor to my colleague Alyosha, who will start the webinar. Thank you.
Thank you, Francesca, and warm welcome to all the panelists. So let's start with the overview and the topics. We all know that the COVID-19 crisis has brought into focus the importance of home environment and, of course, parents' irreplaceable role in young children's well-being, development, and early learning. The pandemic has also highlighted the different roles parents have, as well as the need to have a flexible and inclusive early childhood education and care programs and services that can adequately address the challenges faced by the most vulnerable, such as Roma, migrants, refugee children, children with special needs, and families living in extreme poverty. In many cases, the measures taken to mitigate the pandemic have created additional threats, such as widespread job and income loss, a surge in domestic violence, denied access to the basic services, lack of humanitarian support, stigma and marginalization, and of course, food supply emergency. Acknowledging this is fundamental to address not only the short-term, but especially the long-term impact of COVID-19 on parents and young children's physical and mental well-being. The webinar aspires to share examples of successful approaches for supporting the most vulnerable families and young children in 4 European countries: Italy, Belgium, Germany, and Ukraine. And now that we learned more about our panelists and get a little bit more familiar with the topic of today's webinar, it's also time for us to learn more about you, dear listeners and participants. And we would like to learn more about the specific vulnerable groups you are working with. That's why we are launching the online polls, and we would kindly invite you to participate. So now I will launch the poll. Just a second. So, and by now, you should be able to see on your screen the questions. You can select your answer by ticking one of the options on the right side of the panel. And of course, you can start voting now. So we will have a few seconds so you can leave your answers. And once the televoting is done, we will share the results with you, so we'll be able to see what is the proportion of the most vulnerable groups we are working with. So you still have a few seconds. I can see that almost more than 50% of participants voted by now. So go to the right side of your screen and indicate the group you are working with. So we have more than 60%. Soon I will close the voting session. So here are the results. And thank you for your contribution to the polls or to the televoting. And as we can see, most of you participating in the webinar are mostly working with families living in extreme poverty, almost 40% of you. And that's great because we will also address in the next presentations some challenges and effective approaches and efforts that international agency, grassroots organizations, and city governments have taken due to the current situation. So let's start with our presentations and learn more about the major challenges that the COVID-19 crisis poses to the vulnerable young children and their families, and how different international agencies Grassroots organizations and city governments have responded with universal, holistic, intersectorial, or integrated interventions. So in this part, we'll also learn more about the effective approaches and efforts that organizations from Italy, Ukraine, Germany, and Belgium have pursued in order to reach out to the most vulnerable children and their families. And now it's time to start with the first panelist, together with Sara Shokri from Italy, from Associazione 21 Luglio. We will learn more about the work that they're doing in Italy with supporting young Romani children and their families. So, dear Sarah, would you like to share with us and with the audience some insights about the immediate response to the COVID-19 outbreak in Italy? And very warm welcome to the panel.
Well, thank you very much. Good afternoon, everybody. Thank you, Alyosha and Francesca and the whole ESA team for organizing this webinar, for having me here talking about this issue and about the work of my organization. I'll just give a brief introduction. We are a no-profit, and we support groups of individuals and individuals in condition of extreme segregation and discrimination. We are active since 2010, and we are based in Rome. And we have an extensive experience in advocacy action, campaigning, research, and empowerment activities, all aimed at enhancing families' access to educational and cultural services. We have been working in these 10 years in the main shanty towns of Rome. And since 2016, we are also in a very marginal area of Rome. We manage a cultural and educational center where we organize activities addressed to the main public, because all the families there have socio-economical vulnerability. So it's Italians, migrants, refugees, Roma, no Roma. And the 41% of these people are in absolute poverty, and 22% of these people have zero income. So that's what we do. And I think it's worth mentioning something about the Italian context. So I would go to the next slide. And yeah, so Italy is quite peculiar. It's called the country of camps. So I think I should say something about that. It's called like this because there's no other country where the government has designed, funded, built, managed, institutionalized, sometimes even monoethnic encampments where Roma have been intentionally isolated. And I'm not talking about welfare shelters, I'm talking about shipping containers used as housing units. So I'm talking about ghettos. They're absolutely highly segregating. They're built outside, far from the city center. There's no public transportation very often. Sometimes there's no electricity nor running water. And so they're far from whichever basic services, schools, workplaces, hospitals, grocery stores. So obviously the minimum standard of living are not guaranteed there. And the result is that life expectancy in a camp is 10 years lower than that of the rest of the population. And this has implications in the enjoyment and access to the right to education and health as well. So that was our context before COVID. Then COVID happened, and I would go to the next slide. And we were paralyzed. We didn't know what to do because obviously it was shocking. We knew about the conditions of people living in housing emergency already. So we just decided to do what we usually do. So every time we want to start an intervention, some actions, we need to know what is happening. We need to understand the needs of the population. So we went, well, virtually there, because we conducted a research over the phone, obviously, because we were not allowed. And so as soon as the lockdown was declared, it was clear that there would have been problems, because nobody was allowed to leave their houses except for emergency reasons or for work reasons, and the job had to be related with the production and or distribution of essential goods. So we conducted the research, and the findings were there was a total absence of public intervention by both the municipality and the health authorities. So there was no information provided, no medical devices. People were already in food deprivation because they stopped working. Obviously, they all, basically all the families rely on alms or informal jobs, so nobody was allowed to keep working, you know. So it's quite a desperate situation, and obviously the hygienic conditions, the inevitable promiscuity in the camp due to the limited room available, because each camp has maybe 400, 500, 600 people living there. You know, it depends. It's different communities in the same space. So the structure of the camp itself made the prevention measures ordered impossible to implement. So that was the situation. And after that, we immediately launched an appeal. So that's the next slide. We decided that the most important thing was to do an advocacy action. So we launched an appeal addressed to the mayor of Rome and the prefect of Rome to guarantee at least the minimum, the basic necessities, running water, hygienic sanitary conditions, acceptable hygienic sanitary conditions. And we also started a fundraising campaign because food deprivation was an immediate response that we had to, you know, give. So I have to say a lot of individuals donated. So we, it's the next slide. And so we managed to give immediate relief to the most vulnerable families with children aged 0 to 3 years old. We involved a pediatrician and an obstetrician to understand what was what kind of baby parcel we would have to design. So it was customized baby parcels with baby food and diapers and wipes and anything necessary for these children. And we managed to reach 400 families, and we are distributing these packages weekly. So that was huge, and we're really glad that our community responded so well. But then there were also other problems. The right to education. So it is true that was a problem for the whole country, but for the most vulnerable, it was even worse. So we have always collaborated with schools and with families. We also supported parenthood during these years, of course. So that's what we kept doing. We worked as mediators. Some children were just unreachable. So we really tried to reach these kids, and we even provided tablets and data when possible. We kept tutoring kids, and we worked as a help desk as well for the schools that were not prepared at all because of the, you know, just a lack of competences, and there was just no clear information from the government as well. And next slide. We also designed a set of activities for children and for parents. So we started a long-distance film forum. The Fairy Tales Over the Phone was really, really successful. It was a phone line active 2 hours per day, every day. So we translated in Romani the Gypsy fairy tale. We translated it in Italian and in Romani. So parents could call this number, and children could just listen to the stories. And that was really, really nice. Then we had WhatsApp groups and Zoom meetings organized with a professor of anthropology. And he basically is sort of leading these meetings, helping mothers to share their feelings, to understand what is happening, just giving sense to what is happening. Because here in Italy, we have been under lockdown for 2 months, and we were just not allowed to leave the houses, not even to walk, to have a walk with our children. So that was really, really stressful, especially for the most vulnerable that maybe have other, you know, psychological, economical problems. So there was a lot of confusion and fears, and that was really important. We also provided some psychomotor recreational activities because parents had to be not only parents, but also educators. So for preschoolers, you cannot do learning at distance with preschoolers, right? So what we tried to do was to support parents, giving them just the inputs, some, you know, some examples of activities, and you have a nice picture here. And then obviously assistance to get economic support, because eventually the government released a fund to help the most vulnerable families, but not everybody has, is capable of even just asking for the economic support. So we did that. And then the promotion of mutual aid, I think that is important. During the research, we realized also that the pandemic was affecting solidarity within the communities, because there was a sense of confusion, mistrust, this idea of social distance. What is it just physical? Is it something more? So we really decided to start thinking about this, and in this second phase, we are also working on this. And I think my presentation is over.
Great, thank you, Sarah. And now I would like to ask my dear colleague Francesca if she can jump in with some questions from the audience before we move to Olena.
Yes, thank you, Alyosha. So yes, we have a few questions. I would like just to put one of them, and it's about the mental and psychological well-being of children inside the camps, because as we know, the situation, the condition inside the settlements, especially the formal settlement that you were describing, are quite difficult. So our audience was asking about, did you do something to provide also some kind of mental and psychological support for families, children, parents who live in the camps to face this situation, this special peculiar situation?
Yeah, of course, that is an important issue, and that's why we started these WhatsApp groups and these Zoom meetings to support even the psychological, the mental health of the families. Obviously, that is not enough, but unfortunately, when we were not allowed to go there directly in person. So that is something that we are gonna work on during this second phase, now that we are able to actually go there and meet the families. So we did give some support over the phone and over WhatsApp and Zoom. We have a lot of educators and psychologists that work in our staff, but it is something that is starting right now. Together with the promotion of mutual aid, we also will address this, obviously.
Great. Thank you, Sarah. Thank you, Francesca, for the question. And now it's time that we move to Olena Kloba. So let's move to Ukraine. And Olena will talk more about children with diverse needs and present how Ukrainian StepbyStep Foundation has reacted to the COVID-19 pandemic. And just to highlight, so your topic will be particularly very interesting to 24% of our listeners today who declared that their focus is working with special needs. So welcome to the panel. The floor is yours.
Thank you, Alyosha. Thank you very much. Greetings from Ukraine to everybody who is watching us just now. And today, once again, I'm Olena Kloba. I'm from Ukraine, and here I'm on behalf of Ukrainian StepbyStep Foundation. I wanted to tell you that our organization is operating for almost 20 years with a key focus on making the education system more inclusive through both direct work with teachers, as you see, children and parents, and building better policies. We also have a profound experience of partnership with different international organizations such as ESA, as UNICEF, International Renaissance Foundation, and Open Society Foundation. The next slide, please. As we work with different preschool organizations and early intervention centers, these are centers especially for children with disabilities, both physical disabilities and mental disorders. We conducted a survey, for focus group survey, to identify the needs of teachers, the need of specialists, the need of educational institution administration, and also to identify the needs of parents who were from the quarantine period that were introduced to Ukraine. So the major challenges we faced as the COVID-19 was in Ukraine was that all educational institutions were closed, mostly in all countries, and there was no online support tools offered for children and parents. We also faced the lack of technical and pedagogical skills, as well as institutional capacity to provide assistance and service under new conditions, and also the poor, or let's say insufficient, communication relations between educational institutions, teachers, specialists, and parents. All of that means that we faced a lot of different challenges and constraints in the new conditions, but we have to react on them. So we decided, the next slide please, we decided to figure it out into two dimensions. The first one was to support educational institutions themselves, to support teacher, administration, narrow specialists, and the second one was to support the parents, and through the parents we can support children. Let me tell you about the dimension one. We conducted online consultations, webinars, launched webinars, and the technical trainings in using online tools. So what does it mean? It means that we conducted this series of different webinars or let's say seminars, webinars, or whatever, on how to use the appropriate platforms, programs, tools to provide this to assure this technical issue, so everything will be so that actually teachers and specialists can use them, because we discovered that it was a really big challenge for them to use all these new programs, and they have insufficient level of skills. Also, we had these online consultations to tell them more about the methodological process and about how to talk to parents, how to organize this communication, how to have actually regular communication with parents, and how to have the staff meetings even within the educational institution. But the mostly we concentrate our attention on support to the parents, because the children were the main target for the main group we had to help to, and we organized the targeted online session by relevant specialists such as speech therapists, psychologists, defectologists, and other. It was made jointly with UNICEF. Also, we provided the regular newsletter materials for parents, which were distributed through different messengers, through different social media groups, Facebook groups, Viber groups, WhatsApp groups, and other. And also, we had these technical trainings in using online tools as well, because the same problem as with teachers, we had the same problems with parents. They also didn't know how to use different online platforms, how to have regular communication and correctional lessons to their kids provided by these online tools. So we also introduced them Zoom, Skype, and other programs. And also there was from our side facilitation of parent networks and groups via messengers and social media. That means that we knew that parents, they joined it into some kind of groups where they have in their messengers on the social media, and they advised each other how to cope with this new conditions we were living in, how to tell their children about the ongoing situation, how to create the psychologically safe environment for their children, how to provide additional correctional lessons for their children. So there was like a pool of different parents, and they were like facilitators, and they could share their good examples, good practices, and good advices to help each other. We knew about it, and we facilitated it on a better level, because we spread this experience, their experience, to other regions, and shared it on let's say, one more level up. This was the challenges, main challenges we faced with. Can you show me the next slide, please? Because so here are the pictures from the joint webinars with UNICEF. it was a great support from them, because with these joint webinars, we presented actually for parents how can you manage your free time, how can you organize your free time for your kids, and how to do it in a manner when you combine when you keep learning children and keep them healthy. Especially it is for children who have physical disabilities. It was very challenging, because you have to provide them ongoing regular consultations of necessary specialists, neuro specialists, and it is very difficult to do in the conditions when you cannot provide this face-to-face format. And we know that it demands face-to-face, sometimes face-to-face format. So we decided that the best solution will be to organize them on a regular basis. That was a very important issue, to do it on a regular basis, not time to time, not monthly, not weekly, but regular basis, so the children can keep them healthy, and to keep this feeling of belonging, that everything is still okay, we're still moving in the normal format, and just everything will be okay. And it was very, very important for the children. The next slide, please. Also, these are pictures from materials which was designed also, which was UNICEF designed, and we spread it on our website, on Facebook, and we spread it among and disseminated among the parents in different regions and the preschool facilities we're working with. And the next slide also, it will reflect our own materials that we produced for parents, especially for parents. It is how to organize your free time with children. It was a set of different approaches and methodologies, how parents themselves, in a very simple and understandable way, how can they care about children, not just daily care, but something with a learning aim. So how to keep their learning still in the conditions we have at that time. So these materials were designed by StepbyStep Foundation. Actually, as I don't think so. The next slide, is it my slide? Yes. Okay. No. It's an example of good practice. I think we will return back. Yeah. Or now. Now, yeah. Okay, so very quickly, one example of good practice, it was Lysychansk Preschool Institution. It is Lugansk Oblast. You may know that these regions are affected by the military conflict. Sorry, that is still in the eastern part of Ukraine. So majority of children in this preschool institution, they moved from this zone affected by military conflict. As a fact, they often need some psychological support. So they have some kind of traumatic experience, and this preschool facility, they're concentrated on the help for such children. This preschool institution, it was a project of Ukrainian StepbyStep Foundation in cooperation also with UNICEF project. So yes, this, as I said, this kindergarten, they focused on children well-being, sure, and parents supporting face-to-face activities, mostly face-to-face activities. Next slide, please. They decided that staff went through a series of trainings on organization of distance learning, yes, like online tool, platforms, programs, and the Ukrainian StepbyStep Foundation, they assisted in the instruments choice and conducting of training. So we helped teacher staff and specialists to choose what are these instruments, which instruments are better for the children with in the condition they were there. Okay, and the teacher then they even designed the separate website where they put a lot of different information, very profound and interesting information to how to organize the free time of children, how to organize this period of quarantine in a good way, not to lose this psychological atmosphere, and to allow children to keep learning. Ukrainian StepbyStep Foundation helped with development of instructions for parents for materials and recommendations they have, because this preschool, they developed some materials and games for children, but we face the problem that the parents have no idea how to play with them actually according to this material. So StepbyStep Foundation helped them with the very detailed prescribed instructions, and the teachers facilitated close communication also between children, parents, and their peers. Ukrainian StepbyStep Foundation moderated this discussion of ideas and good practices with other teachers and specialists. I told you that we disseminated this good experience to different regions, and it was very good for them because it's a very practical examples on how can you solve the problems. And the next slides, you will see the pictures from the website that was created by this kindergarten, and so they have really good things, combining this physical activities and combining some very specific methodological, pedagogical, and psychological support for children. I think that it is probably, it's the way you can have a good time with children, with drawing and other things that in a very
great. So thank you, Olena. Now I will just pass on to my colleague Francesca to see if we have any question from the audience.
Yes, we have many. So I will just start asking, how do you support children with special needs and families that have no access to internet?
Shall I answer it just right now or the next? Okay.
Yeah.
So yes, it's also a very big problem for Ukraine because many families have no internet access or limited internet access, or have several children while they have to be on the internet at the same time. We physically asked our teachers who were able to disseminate some kind of materials to the houses of the children where they live, because in some regions you were not you were actually allowed to go out, but with some sanitary measures like masks and social distancing and other things. So we asked teachers to physically distribute these materials, to print and distributed materials to the houses of their kids, and so they have the leisure time, the free time. It was organized in the way we recommended to do it, but unfortunately there were no opportunity to provide the neurospecialist consultation for the kids because it's too dangerous. It was dangerous, but we hope to continue the process after the quarantine lockdown will be avoided, when the quarantine will be mitigated and somehow.
Great, thank you. Thank you so much to both of you. Thank you, Olena, for your presentation and useful insights and great examples of supporting really children with special needs in this really challenging period, not just for them, but for all of us. So, and now it's turn that we learn more about the situation of migrant and refugee young children and families during this challenging period. Dr. Ceren Güven-Gürez, welcome to the panel. And could you please share with us and describe the main challenges faced by children and families in refugee centers in Germany, and what type of intervention and support UNICEF Germany is providing?
Thank you so much for the opportunity to be presenting here, and I give you a very warm virtual hug to all the participants. My name is Ceren. I'm working for UNICEF German National Committee. I would just want to give a very tiny information that we are not a country office, so we are not offering programs, but we are mainly responsible for fundraising and policy advocacy. However, as a high-income country, when we have this pandemic as well, so we thought of course, we need to react. We should not just fundraise and transfer the money to the needing countries, but we need to do something also in our country. Okay, so knowing the fact that I want to give you the overview situation in Germany, how it was. Actually, it's very common where you also experience, but we had a semi-lockdown as of mid of March. Semi-lockdown means we were not locked in our houses. We are allowed to go out, but with a limited contact to others. Then the schools immediately closed, 16th of March. This means approximately 11 million children. So 11 million children affected. This includes also the preschools. And as of today, we have confirmed cases, 175,000 infections, and 8,000 death cases in Germany, unfortunately. Closure of the schools also triggered closure of playgrounds, closure of sport places, etc. And then it also brought the financial problems. Germany is one of the strongest economies in the world, but as of April 2020, we saw 13% of unemployment rate in Germany, which affected 2.6 million people. And when we look at the refugee and migrant children, of course, as you may remember, between 2015 and 2018, we have the real flux of 1.6 million people coming to Germany, and 1/3 of them were children. But of course, the influx is now dramatically reduced. However, I just checked the statistics for you. The first quarter of 2020, it's been recently published, and it says 37,000 people arrived, and half of them, you know, I think it's important, half of them are children. So we still receive people, and half of them are children. And the last point for that is expected increase in domestic violence. I underlined it as expected because it was not easy to reach evidence-based information about this. Okay, next slide, please. So following to the overview situation in Germany, what are the major challenges? What are the identified gaps we as UNICEF German National Committee thought of? Lack of channels to reach out the most vulnerable children. How can we reach the most disadvantaged children? How can we reach disabled ones? How can we reach the victims of the violence? How can we reach refugee children? We are working with the government authorities. We are not working directly with the children. So all connection is almost cut. Lack of evidence-based data. A lot of things are based on assumptions, and this is very difficult and also tricky to develop a policy or take an action. No attention on child participation and family-friendly policies by government because, as you all know, children are the less affected from this pandemic. Therefore, okay, they are strong, they are not infected, fine, let's just forget about them. No, this was one of the major issues we had. Gaps in child protection measures. What will happen if all partners, all parents are infected and brought to the hospital? Who is going to take care of children? Is it the youth welfare office? Or is it the neighbor? So a lot of information gaps popped up. And access to education, as I said, just dramatically cut. No preschool, no secondary school, no primary school, nothing, no university. Risk of child poverty, of course, very much correlated with the unemployment rate, which will trickle down to child poverty. Lack of prioritization of mental health and psychosocial support. Of course, it's normal, it's not a critic, but the first attempt is to prevent, to cure, and the mental health always remains secondary. But then now it's been already the 3rd month, it's still missing. So and totally no focus on the situation of refugee and migrant children apart from those who we received from the Greek islands. Next slide, please. So these are the gaps that we identified in the first row in Germany, and then in very close contact with UNICEF headquarters and regional offices, we received global UNICEF agenda for action. Okay, and this action, there are 6 specific topics identified, and it's very advised us also, the national committees, to follow. What are these? Let's glance over very quickly. Keep children healthy, of course, basics. Reach vulnerable children with water, sanitation, and hygiene. Keep children learning, support families to cover their needs and care for their children, protect children from violence, exploitation, and abuse. And number 6, take targeted actions to protect refugee, migrant, and internally displaced children. So these are the guidance that we received. And then following to the gaps we identify, we sat down again virtually and then discussed what could be done. Next slide, please. But before I go to what we have done and we are still doing, I want to give you a portrait of what does it mean to be a refugee or migrant children in a refugee center in Germany during COVID times. Close your eyes. You are in a building, 6 floors. It used to be an office. And now in each floor, next to each other, the rooms, which is your living room, which is your bedroom, and it's also sort of your kitchen, okay? Think about this setup that a lot of external people come to help you, volunteer you. Think about there are also professionals provide you social support. Think about you're allowed to go out, you're allowed to go to school, and think about you have a playground next door, and think about you establish your first friendship with the neighborhood like a normal child. Now open your eyes, everything is cut off, okay? So first of all, it is one of the first measures taken, no external visitors to the refugee centers, which means no volunteers who have been engaged professionally for ages, no schools at all, even no formal, informal schools, because it's a very scattered refugee system in Germany. There are different stages where children are allowed to go to school, where not. When they're not allowed, there are informal school setups established within the refugee centers. This is also cut off. No child-friendly spaces, no child-friendly services, no pregnancy consultancy, no violence prevention, nothing. And you don't have any internet. Because internets are mainly, okay, it's not fair to say this like this because it's very different. There are centers where you have internet in your rooms, but mainly there are centers where you have internet at hotspots because you cannot get together with people you cannot access. So think about you're a student, your teacher offers you virtual classroom, but because you don't have any internet, you cannot. Or forget about virtual classroom, your teacher offers you homeworks, which needs to be printed out. Your parents doesn't have an email account. Okay, I know we have time limits. And think about that privacy, because it's already a big disadvantage to live in communes in a closed setup. Now you are locked in your 7 square meter, 10 square meter rooms, maybe with 6 of your parents, or maybe you are sharing a room with another family. So you lose all your privacy. No activities offered by the volunteers, and uncertainty with the asylum application procedures, because it's also cut off. No face-to-face or bilateral interviews. So it brought a very, very difficult situation about the uncertainties, although afterwards German government declared that all the procedures are frozen up until the next notice. It's Ramadan now, for those who know. It's a very sensitive situation. The waking up and eating hours are shifted. So some wake up in the middle of the night to eat, the others are sleeping. It triggers the conflict among families this time. And no evidence-based data, as I said, to think thoroughly and develop strategies, and limited or no social legal counseling. Okay, but it's the situation is not so dark, because there are centers, refugee centers, who have already adjust to the situation very flexibly, very quickly, because they have had already risk analysis. They have had already standard operating procedures. They are in very close contact with their volunteers who can offer remote services. For example, in one refugee center that I'm in close contact with, said all our volunteers now following one-to-one homework tasks of the children, or some centers offer with the social workers one-to-one bilateral walks with pregnant women, with the woman who had already violence cases, with distance walking. So there are centers who are really providing fantastic services and adjust very quickly, and there are centers they just simply close down everything. Okay, next slide, please. What did we do as UNICEF Germany office? You know, as said, we are responsible mainly for fundraising and policy. Therefore, we used our policy and advocacy power so much to put children's rights, especially the most vulnerable children's rights, on the agenda of the decision makers. So we focused on less is more and establish on what we have already. We conducted immediately a rapid needs assessment with our former contacts, Ministry of Interior, refugee reception centers themselves, service providers of these refugee centers were our first contact. And then we asked them, tell us, what is it going on there? what do you need? We were expecting hygiene materials. We were expecting info materials. They said, no, 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 no. Ministry of Interior provided them well. We need toys. We need games. We need things that keep children themselves busy, or we need things that keep parents and children do something together. We were like, okay, this was not planned. Oh, I have 1 minute. Oh my God. Then we contacted Ministry of Education to ask what are the needs of the schools, because also teachers are code unprepared, let's be honest, right? They are not adjust themselves immediately to the virtual classrooms. So, and then we also scan the various media channels. Next slide, please. Then, based on the information we received, we focus on keep children learning. We gather enormous amount of training and self-learning materials for children based on child rights, and we send them to 16 education ministries, saying that, hey guys, we prepared this for you, please feel free to use it. This is for your teachers, and it is also for the students, that they can do it at home themselves with their parents. And then refugee centers said, we need also learning materials. It came as a fantastic side effect that we started to send free of charge. We are printing and sending these materials based on the age groups and the numbers of the refugee centers to the centers learning materials. It's also free of charge online. You can always download it free if you have internet access. So next slide, please. We also took targeted actions to protect refugee migrants and internally displaced children. As said, when they said to us, we need toys, we need sports materials, we need books, we were paralyzed, because this is something we don't take any responsibility about supply, so to say. Then we said, okay, IKEA Germany, you are our long-lasting supporter. Can you help us? They said, our shops are closed. Are you crazy? We said, yes, but still we need some help. Let's pilot. And then we started the first 3 federal states which accommodate most of the refugees to send toys, books, handcraft materials in addition to our learning materials, and it worked fantastic. Now we are going to expand it to the other refugee centers. Next slide, and I think it's the last slide. We also understood that there are issues on better parenting. So we said we don't have time to develop something new, but look, UNICEF, WHO, USAID, another organization developed already better parenting package, which is now, as of today, in 90 languages. So we shared this with Ministry of Interior, and they said this is fantastic because this is what we're looking for. They printed and they distributed to the families and put them on the corridors. And they reported us back. It's like a magic, because they now understand, they read their own mother tongue and they try to implement the instructions. What we are now doing is, last sentence, promise. Now we are trying to document like a photo diary from different children, a children with a disability, a children living in a refugee center, a single parent with more than 2 kids, to document their all day. Yeah, and then we wanted to feed our social media to create awareness that, please, governments, open your also eyes for these groups. I think I did a fantastic job to finish on time.
Great. Thank you. Thank you so much, Jeren. It was really very interesting to listen to all these immediate responses you were involved in. So, Francesca, do we have any questions from the audience? I think we have time for one very quick question.
Okay, yes, we have one. It's about how do you protect and ensure the protection of the most vulnerable among the vulnerable, for example, pregnant women or children that were affected by violence, because we know that one of the side effects of the crisis is a surge of violence, etc. So if you have any suggestion or any example of protection that you are putting in place in this period. Jeren, you are mute.
Now, sorry. Great question, thank you. When I used to work as the field manager of the refugee and migrant response, we established risk assessment tools, checklists, and standard operating procedures. And we also introduced minimum protection standards of the most vulnerable groups at refugee reception centers. So we really established on something what we had. And as I said in the example, the refugee centers that we are in touch with immediately conducted a risk assessment. They grouped the people based on the risk category, and they adjusted their services accordingly. One of the most vulnerable group is the ones who have already violence history in their background, so that they adjusted their social services one-to-one, sometimes with distance walking sessions, and sometimes with video conferences with telephones, you know. And please don't forget that in Germany we have a very well organized welfare and social service. The only thing is to reach out to people on time, and the problem is to bring the attention of the most vulnerable to the others, because the regular people receive the service anyhow, but how can the others reach, especially in mother tongue? That's why we really built up on what we had, and we are now disseminating best practices with other reception centers as well. I hope I could be able to answer. If not, I can happy to further elaborate. Over.
Thank you so
Great.
much.
Thank you, Jeren. Thank you, Francesca. Thank you to both of you. And now it's time that we move to Belgium, to the beautiful city of Ghent. And today with us is our dear colleague, Lieve. And could you please share with us more about how city government has reacted to the crisis with effective and comprehensive policies and measures? So, Lieve, the floor is yours,
Yeah,
and
okay.
welcome to the panel.
Thank you, Alyosha, and thanks to ISA for organizing this opportunity. And I also want to thank on beforehand my colleagues, of whom some are listening, of course, to this webinar, because it's only due to their work that I can do this presentation. You've already introduced the childcare service of the city of Ghent on beforehand, but I thought it was a good idea to mention some things that are permanent in the city of Ghent in ECEC, which have really helped us through this period. And they are in fact 4 things. One is that we have an existing cooperation with education and all the schools, which really helped us because we know each other as partners, and the schools have closed very soon in the lockdown period, while everything that was ECEC remained open. A second one is that we have developed a system of working together with social services and family centers, which means by having this system in place, we could also use it, even though it was much more difficult now. A third one is that we have this existing system of affordability. So we already have this system in place where access is built up to the maximum for vulnerable families. And a last one is that we have a pedagogical team in place for ECEC, which also provides with initial training and continuous professional development. So I think these are 4 things from the city perspective that will help you to understand my story. Next slide. So our first challenge is that we noticed that, of course, people were very afraid. We also noticed that especially vulnerable families were confronted with a lot more fear, and they really locked themselves in, because people could still go out for walks in the beginning, and we could see that the most vulnerable communities were really had the highest rate of fear. So what we did is we implemented a way of working which is called contact bubbles, and the contact bubbles are like groups of children and childcare workers that are put together. We decided that the number of children in these bubbles would be smaller, so we could give more attention to the children, and we also would have permanent personnel in there so they would feel safe. But of course, the children, even though we stayed open with ECEC, wouldn't come to the service if we couldn't convince the parents. So we implemented different things, like there's been translation of all the communication, but even more so, we developed a system in which we stayed in contact with every single family of all those children that we knew before COVID times. And then, of course, ECEC people, they kept working. Most of the, except for the health and the medical services, In fact, at one point, we were the only sector that really remained open. Yeah, so it meant that we really had to work on lowering the stress level and informing our staff really well, and that was done by daily Q&A. Yeah. Next slide. I have to say this. Okay. So the next challenge is how could we reach these vulnerable families? I have to inform you that in the normal situation, we have a social mix with 40% of vulnerable people. And what happened is that once we had the lockdown, even though we stayed open, we had some categories implemented by the higher government that were allowed in. Yeah. One of these categories has always remained vulnerable families. Yeah. So we had this gateway in which we were allowed to reach them, to reach out to them and to bring them to the ECEC services. As in the beginning of the COVID period, the attendance of children dropped to minus 10%. Today it's nearly 60% again. We had all this stuff available, yeah. And as I told you in the beginning, as we have the system of the pedagogical team and the childcare workers, who are about 800 people that are used to being trained, we could retrain the staff really quickly. We did this with digital means, we did this with spoken PPTs, but we also provided with interview protocols. So when they would reach out to the families by telephone or also by house door visits at social distance, we could gather all this information, and it could give us an insight on what the difficulties were that the families were facing, especially because we saw that also domestic violence, height of stress in families was really augmenting. It also not only helped us to have a higher attendance of vulnerable family children, but it also helped us to detect what the problems were. So even if we couldn't convince parents which were in a too stressful situation or not safe situation for their children to come to the ECEC service, we did detect what the problems were, and having this system of permanent cooperation with social services in place, as I mentioned in the beginning, allowed us to draw all the needed help and social aid or financial support to these families. Yeah. Next slide. So, organized integrated services. It might be that I've gone a bit too, yeah. Okay, what I'll present you is next after this will be a story which will explain you some of these challenges and our answers. But before I do that, I want to inform you that the city is not only providing with service, but we are also coordinating on a city level. Yeah. So this has allowed us to have a wider action radius than what we provide for. We provide for about 27% of the ECEC service. So having this mandated coordination role also on beforehand, and having this existing cooperation with social workers, and also the fact that we could offer childcare for free. It was implemented by the higher government for the Easter holidays, which will be the practice that I will go into with you after this. But we have it as a system on a permanent basis. So for people that can't afford it, financial accessibility is always guaranteed. Next slide. So now I'm going to dive into a story with you, a story that kind of represents the things that I've informed you about, as we call it, the competence system we had on beforehand and what it did to us in Corona times. So one of our out-of-school services, which is called Ibo Melope, as mentioned there, is very close to a refugee center, which is called Reno. And Reno, in fact, is a boat. It's a boat that is lying in the harbor and which has been rebuilt as a refugee center. It was there before Corona times, yeah. The families that were living there had about 20 children that had recently arrived, and they were not accustomed. None of them knew the building or the school where we provide the service. Yeah. These children were between 5 and 12 years old, and they had recently arrived from the countries that are mentioned on the slides. And as you can see, it means that the larger part of these countries were war or civil war situations. So a lot of them had lived quite traumatic situations. Next slide. Okay, so that was a very challenging context. We have, as I explained to you, these special measures in which we installed 3 contact bubbles in Milurinupi, because the nice thing is that the crew from the refugee center and from the out-of-school service decided that for this time being, they would combine their names, which shows how also close the cooperation was. The other thing is, oh my God, that we have no access for parents in the building, as normally we do have this access, and also that we couldn't do this. We had this situation in which the first introduction to the ECEC was totally not normal because the parents couldn't access the building. Further on, there was this many different native languages. Children wouldn't speak Dutch, and our childcare workers don't speak other languages. Okay, next slide. My God, I only have 1 minute left. Okay, so we did see that the contact bubbles, we mixed the ages. We put together as brothers and sisters for reasons of security, but we noticed that recently developed friendships for these children were very important. So we reorganized the contact bubbles along friendship. We saw that we had no access for parents, in contrast to how we normally work, but we had daily talks with parents outside, and it was based on our pedagogical documentation program. So children would provide with the images that were important for them during that day, and it allowed us to have a non-language conversation with the parents. Next slide. It also provided us with a close cooperation with the refugee center, and as we have this system of integrated services in place, we could project that system onto that cooperation. So it meant that they really adjusted their daily routine to us picking up the families, to us helping us out when we noticed there were extra stress factors with the children. So they could provide with the aid, psychological aid, or whatever was needed for the families in the center itself. Okay, next slide, because I do want to show you some pictures still. I'll talk quickly.
Okay, and in the meantime,
yeah,
I will just ask Francesca to join us. So if she has some question from the audience, and we can take a look at the pictures from the city of Ghent.
Okay, but I want to, if you can go back one time, Alyosha, one slide back, can you? Yes, I want to show you that there's unexpected plus results. Even though we had these Corona times, because of the way we organized ourselves, we've succeeded in bringing these children permanently to education and ECEC after these two weeks of Easter break. And I invite the public and the audience to look at the pictures, especially this boy in his yellow jumper. He was a boy that was really traumatized, felt really afraid. The children feel so safe. We really focused on well-being and involvement. This happened like in only 1 week time, that children kind of came to themselves and could enjoy being children again. I'm very sorry that the time is so short, but this was a beautiful story which shows that even though there was no access in these difficult times, if you have the right systems in place, you can even end up with full access for the most vulnerable families.
True, that's great. Thank you so much, Lieve. So Francesca,
Thank
do we
you,
have any question? A very quick one.
Okay. Yes, from your presentation, Liv, we heard that the integration of services and also the affordability of services are two of the main pillars of a competent system. So from the audience, the question is, how do you ensure that services are affordable and integrated? And also, do you have any suggestion for other municipalities that want to take the same path?
How to ensure it? I think there's two things that are very important there. It's this coordination role in which we can monitor all the ECEC provisions, and we also know very well by working together with the social services what the number of people in poverty are. Yeah, I think the other is to do a lot of good policy work. The past 4 decades, we have built up a local political floor that is convinced that putting money into ECEC brings more results than it would cost when you wouldn't do it. So it is also about doing a permanent policy work from the practice, and we implemented a local decree that guarantees after if we do interviews together with social services and we decide from the locations and the social worker that it is a good thing to decide that it will be for free, that we are mandated to decide that it's for free. So it's a working together of social work, ECEC, policy work, and convincing politicians and putting it permanently, durably in place.
Thank you.
Great. Thank you so much, Live. Thank you, Francesca, for the question. And dear participants, dear listeners, you can still share your questions in the question section, and we will try to address few of them at the very end of the webinar. And now we are moving to the next slide. So let's explore remaining challenges. From the presentation, we have learned there are still challenges to be addressed for the future in order to avoid long-term consequences on the physical and mental well-being of vulnerable parents and young children. Moreover, the need to adapt to a new reality is becoming an urgency for all of us, as the COVID-19 restrictive and emergency measures will soon be softened in the most European countries. So, dear panelists, I would like to invite you all to switch on your cameras, and we will go first with Sarah. And very briefly, because I'm also mindful of the time, we still have roughly 20 minutes to finish this webinar, and we will go through the remaining challenges. Sarah, would you share with us what are still the remaining challenges, either priorities or the next steps in supporting the most vulnerable families and young children?
Thank you. Well, for me, it is really difficult to set priorities and list challenges, as there are so many, really. And what I think is that the pandemic revealed or just exacerbated problems, issues that were already there. So, of course, there will be a growth of inequalities, which is related with parent discrimination, because when you have growth of inequalities, then you have more social discomfort, and then scapegoats, and then more discrimination towards minorities. I think for everybody, it will be an issue, the fact that schools were closed, and not just the schools, but any educational service was shut here in Italy for 2 months. And actually, we don't know if in September we're gonna start again, we're gonna go back to school. So for preschoolers, for example, this long time away from schools and from educational centers will lead definitely to some sort of disorientation, uncertainty, and sense of loss. And it will affect the psychological development of the kids, because these places are where they bond, where they socialize. It's where they build their personalities. I want to stress access to safe housing and donors, because I think for us, for example, it would have been much more efficient and effective to have flexible grants, as all our grantors are more project oriented. So we had to reallocate, redistribute, change, extend, stop. These 2-3 months have been just crazy. And as an NGO that responds to emergency issues, for us it would have been much more efficient to have flexible grants, and then the access to safe housing. This is pivotal. We already knew that because we have been doing this since we started this association. But if you don't have access to safe housing, you cannot guarantee any other right. So I think these are going to be our main challenges.
Great, thank you so much, Sarah. And
Welcome.
now let's move quickly to Ukraine. And let's explore what are the remaining challenges in regards to supporting and working with children with diverse needs. Olena.
Yeah, thank you, Alesha. Yes, still we have lots of restraining factors, and one of them is that we still have insufficient level of technical skills that are necessary for teachers and nerve specialists. And sure, many aspects require face-to-face format, as I mentioned before, so it's nothing to do with it, because some of the activities should be done only face-to-face format with children, like massages and speech therapists as well. We have the budgetary constraints due to the economic effects of pandemic that are likely to negatively affect the services and support to vulnerable families, unfortunately. We still have some panic and among parents, and they still feel themselves frustrated and distressed. So this situation, there's a personal stress of the parents, it may also negatively influence the atmosphere in the families, and we'll still have to continue to work on it, to cope with it. And we also do need to conduct more systemic research on how these online tools, programs, and platforms that are the programs that we propose suggest to parents and teachers that how can be used to help the most vulnerable children and families to deal with this, to cope with this problem.
Great, thank you so much, Olena, for your input. And actually, it's true, like face-to-face meetings are really very crucial in supporting child's development who is having special needs. So yes, now let's quickly move to Germany, to Jeren, to see what are the remaining challenges in regards to the refugee and migrant children and families.
Yeah, Germany is here again. So the COVID-19 pandemic will have broad-ranging long-term humanitarian and socio-economic impacts on refugee and migrant children. It's a long marathon to run, as it's indicated on the title. And many of these effects have yet to be seen, so we don't know them yet. We just assume. Therefore, we listed at least 4 items that to take attention to underline again and again when we are meeting with the policymakers, decision makers, and also those who allocate budget for these activities. So sound policies to ensure meaningful participation of refugee and migrant children for preparedness, prevention, and response to COVID-19 is one of the most important things for us. Because as I said, we should not assume what they need. We should ask them, and we should involve them. We should do with them if we really want to reach results. As the example that I have given, we expected that they need hygiene materials, but it ended up with toys, for example. So support and advocate for safer housing conditions to allow for social distancing. As said, there are still refugee centers, approximately 500, 600 people living in one compound. So therefore, we need safer housing, ensured continued learning also for the most vulnerable groups, and catch-up programs for them as quick as possible, and minimize the economic impact which fuels poverty by extending social protection policies. Over. Thank you.
Great, thank you, Jeren. And really, it's true. Involving them, asking them to be successful. And now let's move again back to the beautiful city of Ghent, to our colleague Lieve. And Lieve, could you please share with us what are the remaining challenges?
The remaining challenges for us are as safety is the priority in this new normal. We are very worried about ECEC as a warm second home, open doors, connecting with the neighborhood, the connection between parents, having parents inside our locations, as you can see on the picture, and connecting children again. Next slide. We also have come to the conclusion that we will have a new group of vulnerable families, working parents who are out of work for a long time and at risk. Because we monitor well, we have seen that in April, we have 80% more families that had to ask for social or financial aid, which is very high because we already have a rate of 25% people, families living in poverty. Next slide. It demands extra effort from the staff, this new normal. This means that we have to keep on investing in this CPD, participation and intervention, but digital seems to be the new normal, and we don't believe it's apt. If you see the picture there, that's the sort of trainings we do normally with our staff. And the last one for us is ECEC are the heroes of today. Everybody cheers out for us, but will they keep it in mind, and will it change something to the low wages and the low funding for ECEC, which is a problem in a lot of European countries?
That's true. Thank you, Lieve, for your input. And now, since we are almost running out of time, we still have minutes, we would like to address one question from the audience. So now I would like to invite Francesca to pick one question from the audience and ask our panelists.
Okay, yes, I have a question that is for all, and it's about the role of ECEC professional and practitioner. How we as practitioner and professional can ensure that the most vulnerable families are empowered enough to participate in decision-making processes and also listen to, especially now in this new normal?
We were definitely already ready for it. I think one of the main characteristics of ECEC, having encountered so many international colleagues, is this warmth and this connection with families, and because it's all centered around the well-being and involvement of children and families. But I do think it needs to be implemented on a system level, and working together with social services also on a policy and local level will help us to give these answers long-term, whether it's Corona or not Corona time.
Yeah, we completely agree. Thank you, Lieve.
Maybe I can also add. I think it's also very important to put it in the center, because as you see, when we cut the relationship, we lose contact. ECEC professionals are the key, are the center in not only to reach the children, also the entire society, the entire environment of the children. So this is the crucial strength of this. Therefore, system strengthening and also budget. You know, when we are opening up when we think about the children, the first thing that comes to our mind is opening up the schools. What about the preschools? What about the counseling services? What about the ECEC services? So I think we should work more to put also ECEC on the agenda of the decision makers and how important it is. Economic investment, socioeconomic development perspective, and also the human touch, which we missed dramatically within the last three months over.
Well, I agree 100%. I don't have a proper answer, but it is a huge problem. And as we are seeing now, our task force never have professionals from ECEC, for example, or from the educational sector in general. So this is something we should really be advocating for. I don't see a future really if we don't do that, if we don't have more participation of professionalism and, well, citizenship. It is a huge issue, and we will be advocating for that. but we had really strict restrictions from the government, really not enough funding. So that there is not a lot we can do for this. Actually, it's more about advocacy, really.
I want also to add that being a practitioners in ECEC sector, we should bear in mind that every child is unique and there is no general recipe for everybody. Nevertheless, we always have to find an alternative way to address the needs of all children of vulnerable groups, and we have to design a strong cohesion between different on different levels, involving different structures, organizations, and other to assure that the need of every little child is guaranteed and the need of every little child is addressed. So yes, and I totally agree with the previous my colleagues that we should involve parents definitely, because parents may always serve as advisors and experts and advocates for their children.
Great, thank you very much. So what to say, dear panelists? Thank you very much for your contribution, time, and collaboration. It was pure pleasure to learn more about your amazing work in supporting young children and their families, especially those coming from the most vulnerable groups. Your work is really highly appreciated. And dear participants, dear listeners, thanks for choosing ESA webinar and investing your time in professional growth. We hope that today's examples have answered at least to a few of your questions or dilemmas. And we hope that we fulfilled your expectations. And let us close this webinar with the following quote. If we all join forces today to respond to the needs of the most vulnerable young children and their families, we will build a more inclusive and equitable society tomorrow. And if we move to our last slide, on behalf of the International StepbyStep Association and Bernard Fallier Foundation, we wish you a pleasant day and overall success in your professional and personal life. Stay safe and sound. Until we meet again in the next webinar. Goodbye.